think about it. If you want people to be okay, how could you get rid of something like the health service? How and why would you?
Today we're hitting the streets to hear from people about the health issues they are facing every day.
When I was first suspected as having endometriosis and I wasn't eating, I couldn't move, it was very difficult. I was on a waiting list and it took 2 years to be able to see a consultant.
The waiting time's really difficult, and if you are in emergency care units or A&E, you're waiting for 10 plus hours.
I know people who've actually decided to fast track enough private healthcare because they're fed up of waiting.
10, 15 years ago, it wasn't even a week. It was, can you come back the day after tomorrow?
I mean, it's not only problems with access, it's problems with doctors, it's problems with nurses, it's retaining staff.
I don't have to go to the dentist, but I spent over 2 weeks, £700 on dental treatments because I had to go private because I couldn't find a dentist that was NHS.
I wouldn't want a system where, like America, you know, if you've got a long-term illness like diabetes or leukemia or any of those things, basically you're left to die.
And I'm a huge believer in the NHS. It saved both of my parents' lives, but it's not something which should be happening. And also the privatisation of other elements of the NHS has a complete knock-on effect.
It's very difficult who to hold accountable because so many nurses and doctors, they're underpaid, overworked.
Yeah. The issues highlighted in our videos aren't just isolated opinions. They are backed by data. The NHS needs more investment to cope with rising health needs. The UK has too few hospital beds relative to its population. According to the latest available data, the UK has only 2.4 hospital beds per 1,000 people, against 7.8 for Germany. Combined with a very high occupancy rate, the scarcity of hospital beds undermines safety and efficiency, while contributing to excessive waiting lists. And most of the health problems in the UK can be eased or prevented. For example, in 2022, almost 22% of total deaths in England and Wales were treatable or preventable given timely healthcare and public health interventions.
Health is a human right. Achieving the right to health is about creating a world where everyone can access quality health care throughout their life, regardless of who they are, where they live, or how much they earn. The right to health is also about universal access to a range of factors that improve our physical and mental health.
Yeah. I mean,
Yes.
I think it's kind of a fundamental human
Yes.
right. You know, if we're paying taxes, we should have a government that look after us and look after our health.
We should have the right to health in the UK, whether we get it is different.
In 1976, the UK ratified the International Covenant on Economic, Social and Cultural Rights, including Article 12 on the right to health. After decades of budget cuts, the right to health is not being fully experienced by people across the UK. Something certainly needs to be done, but private, expensive medical care is not the answer. The NHS is the answer.
Out of the blue, I had a major operation. Just one day I was feeling a bit ill, and the next day I was having major surgery. And as I said earlier, for 3 weeks I was treated by so many specialists and professionals, so incredibly phenomenal experience of such amazing people. But since then, and now that I'm not going to die, waiting lists, to answer your questions, there is no answer.
Protecting the NHS is the answer. The NHS is still one of the best universal healthcare systems in the world, something to be proud of.
I'm extremely proud of the fact we have the institution. I'm extremely proud of the people that work in the NHS. I very rarely have bad experience when it comes to the nurses, the people that are caring in the NHS.
My dream NHS if I was to wave a magic wand. Just at a fundamental level, I just want to know that the state that I contribute to will look after us at our most vulnerable and not at a cost to ourselves. I can't pretend to know the intricacies of private healthcare or why we have it and why your wealth shouldn't determine your health, I think.
Do you think, as we do, that something needs to be done? Our UK-wide campaign is pushing for change so that everyone can access quality healthcare, adequate living conditions, and a healthy environment.
Join the movement for a UK where everyone enjoys their rights to the fullest. #OurRightsNow. Just fair.